You know, in the controlled chaos of an emergency room, doctors are in a constant race against the clock. They're trying to solve these life or death puzzles happening inside the human body. And they've got this powerful, almost secret weapon they can call on when things get really critical.
But really think about it. How do you find an injury that's hiding deep inside soft tissue, something that other scans just can't see? How do you get a perfectly clear picture of the problem without exposing a patient, or say, an unborn child, to any radiation?
All right, let's get into it. We're going to explore the incredible technology that gives doctors what are basically superpowers of sight. We're talking about the on-call body MRI. I want you to think of the MRI as the ultimate detective. Seriously, it doesn't just snap a picture, it basically interrogates the body's tissues, getting them to reveal their deepest secrets. Now, what's so important to get is that this is not your typical scheduled MRI. An on-call body MRI is an emergency SOS, a call for help when time is literally running out. It uses these super powerful magnets and radio waves to create stunningly detailed images of organs, muscles, you name it. And the game changer, it does all of this with zero radiation. And here's the cool part. An MRI isn't just one type of picture. It's more like a camera with a bunch of different filters. As you can see here, radiologists can switch between what they call sequences. A T1 image over on the left gives them a perfect roadmap of the body's anatomy. But when they flip over to a T2 image on the right, anything with a lot of water in it, like dangerous swelling or fluid from an injury, lights up like a beacon. And that's exactly how they find the problem that was hiding. Okay, so let's see how this actually works in a real-life emergency. For our first case, we're heading to the abdomen, where a really critical injury is trying its best to stay hidden. So, picture this. A 27-year-old man is rushed into the ER. He's had severe trauma to his abdomen. The doctors know something is very wrong, but the first scans they do are coming back unclear. They need answers, and they need them fast. And here it is, the breakthrough moment. While those other scans couldn't give a clear answer, this MRI image is unmistakable. That area the arrow is pointing to, it reveals a catastrophic injury. His pancreas has been completely torn in half. This one image gave the surgeons the exact intel they needed to rush into the operating room and, well, save his life. Now let's switch gears to a totally different kind of scenario, but one where the stakes are every bit as high. What happens when the patient is pregnant or when the injury is incredibly delicate? Imagine this situation. A 30-year-old woman, just 6 weeks pregnant with twins, comes into the ER in absolute agony. The doctors suspect a major problem, but using something like a CT scan with all its radiation is just not an option. The safety of those two tiny fetuses is everything. So what do? They turn to the MRI. And here's the answer. Clear as day and completely radiation-free. The scan shows her right ovary is dangerously twisted, a condition called ovarian torsion, which was cutting off its blood supply. Because they got this definitive diagnosis, she was rushed to surgery, and they were able to save her ovary. Incredible. So that case shows how MRI can protect the vulnerable, but it's also just unmatched when it comes to precision for complex trauma. Let's take this next case, a 32-year-old man with a blunt trauma injury. For him, the exact location of the damage is everything. If you get it wrong, the whole repair could fail. This is what makes the MRI so unbelievably powerful. Okay, on the left, you're seeing a normal scan. See that dark, continuous line? That's the protective layer, all intact. Now, look at our patient scan on the right. See that gap? That obvious break in the line? That's the tear. The MRI didn't just hint at an injury, it pinpointed the exact location of the fracture, which meant the surgeons could go in and repair it correctly right away. So we've seen these amazing individual stories, but let's just zoom out for a second. Why is this on-call MRI technology so fundamentally important in emergency medicine? What's the big picture? Well, it's because this isn't for just one or two rare situations. On-call MRI is an absolute go-to problem solver across a huge spectrum of emergencies. We're talking about everything from finding hidden infections and abscesses, to assessing major trauma, to safely diagnosing pregnant patients, even spotting vascular blockages, post-op complications, and tumors that show up out of the blue. It is an incredibly versatile and absolutely vital tool. When it comes right down to it, in the high-stakes world of the ER, being able to see the invisible with this kind of clarity and safety, it isn't just about finding a diagnosis. It's about making the right call right now. It's about being decisive.